Okay, so it's 10:02 with slight delay, but welcome to another installment of Polish NMR Seminars. Today we have Professor Piotr Młynarz from Faculty of Chemistry, Wrocław University of Science and Technology, and he will give a talk, Application of NMR Spectroscopy in Metabolomic Studies. So Professor Młynarz, the floor is yours. I'm stop sharing and you can start yours.
I hope you can hear me.
Yes, we can.
And because I gave the title in Polish, so I thought that this seminar will be in Polish language. So sorry for the slides, but I will speak in English. And at the beginning, I have to introduce myself. We are doing metabolomic study since almost 12, 13 years. And at the beginning, we started to do it generally in Poland, maybe parallelly to Stefan Jankowski from Łódź. But at the beginning, we saw many obstacles. So this was like some very trivial for the people who are working with NMR. Like how many scans you have to do to get good spectra, which could be considerable for metabolomic study. How long should be the delay? How long should take the spectra at the beginning? So we just start this methodology from the scratch to open a new window for our group. But what was inspiration of our work? Our inspiration was maybe not exactly this picture, but the picture which was very similar to that. So at the beginning we have
Could you please turn on the presentation? Because we are only seeing your face.
You cannot see my presentation. Okay.
Yeah, please click share.
Yes. Okay, sure. I don't know why it doesn't happen because I click already. Okay. Just a moment. So today for too many things happened. Moment, because something is going wrong. I don't want to be sure. Okay, maybe I can do it like this.
Okay, I think now we can see it.
It's not in the presentation mode, I guess.
Yes.
And now?
Now it's in the speaker mode, so we see next slide and so on. So
okay, so just a moment. Try again. Okay, now it should be better.
Yes, now it's fine.
Okay.
So, yeah, we lost your camera, but I think this is not the biggest issue. So.
Okay, so I was speaking about this slide, which was my inspiration to this work. I hope you see it now. Then we have state of health, which means stan zdrowia. Then we think that if something going on wrong, there is some pathogenic factor which influence our health, our body. Then we have the risk of the illness, which is ryzyko zachorowania here. And this is the intervention of the doctor here at the end of this picture. So is here, and what we think is from this state of health to the intervention of the doctor, it takes about 10 years. It takes about 15 years in the case of oncologic disease. And in the other civil disease, it means that it takes something 5 years, 1 year. So we thought that when we just see this period which is before, that we can improve the comfort of life of the patient. And also we are managed to diagnose the disease. And this was the inspiration of our work. It was the year 2009. And we thought, why we don't have to do it in Poland, metabolomics. And after that, I found the paper, which was devoted to diabetes 1, children who seek diabetes 1 disease. And the follow-up was done during 10 years. And during these 10 years, there was the cascade of the events which follow to the diabetes 1, and this was monitored by metabolomics. And this was also our inspiration to do metabolomics in Poland at that time. And we start our job, our work. And what is based on the metabolomics? Metabolomics is based on the assumption that the metabolites which are influx to the cells and out from the cells, and those which are transformed in the cells are in equilibrium. What does it mean? That when we have the good cells, which has the equilibrium between the metabolites which are in and out, we know that is our control. When we have the other cells which has some perturbation in the metabolites, influx and outflux, we can compare it to the healthy control, and then we can see the difference. And what we are doing is just metabolomics, which belongs to the comparative science, because we always have to reference object. And also we are not only investigating metabolites which are influx and outflux, but those which are transformed inside of the cells, because then you extract the cells. I will tell about this in a minute. And looking at the metabolites, we are able to see the level of the particular metabolites, for example, in TCA pathway, and we can monitor them according to the disease, according to progression, according to the treatment of the disease, and in different cases. So still we have the problem, for example, if we have for this ketoglutarate, which is upregulated or downregulated, if the enzyme is perturbed before this metabolite or after this metabolite. But we try to resolve it by different studies. This is proteomic studies or just different ELISA studies. Okay. And we are doing metabolomics by nuclear magnetic resonance and mass spectrometry. Today I will talk about nuclear magnetic resonance because we are in the good companion, which person who are investigated and use this method. We use the bioinformatics tools is statistic and chemometry, which is PCA and usually used in metabolomics, PLS and OPLS, which are the chemometric method, supervised chemometric methods. If someone wants to ask me which method is better, MS or NMR, we cannot say that they are complementary. We cannot compare them. Why? Because MS method is difficult to have the repeatability in the sample studies. Why NMR has it quite good, and we can get really robust method. And if you see this picture with the square, which is here, that NMR cover all the compounds which we have already on the spectra. So we can show all the spectra, all the compounds which are on the spectra, and it strongly depends about extraction method, what we can get. So if you want to have the same result, we have to do exactly the same extraction. We have to do the same methodology. Even the person in particular should be the same, because the error which is doing by each sample preparation, we can see then on our results. If you compare MS, there is the difference in the hydrophobicity and acidity of the metabolites which we can get. It depends strongly about solvent, about the column, about the methodology. So NMR seems to be the method of choice if you want to have the really repeatable spectra, really repeatable results. And all of them are complementary data. If you want to get a good spectra, which is very robust, then you have to do the good extraction of the samples. The samples could be different because, for example, if you take the urine, you just add the buffer TSP and then sodium azide, and is everything fine. So you use it as it was at the beginning. You don't have to make extraction. The same if with the amniotic fluid, the same is with the serum or plasma. But for serum and plasma, you use solvent, and that's all what you have to do. So it's less methodological issue that if you do the extraction, for example, for MS study. But if you want to extract some bacteria, some fungi, cells, cancer cells, then you have to do the extraction. We are doing mostly the false extraction, and we can get finally the extraction from polar solvents. Sometimes we have a paper with the non-polar solvent, but only one. Usually we investigate the polar metabolites by NMR because it's simpler, as you can see. NMR approach is just to find out the signals by genomics in our case. So we overlap the spectra from the database with those which we have on the NMR spectrum, and we can get the area under the curve or the highness of the signal. So we have two factors which we can choose. And what we are doing the molecular profiling, is fingerprinting or targeted analysis. So just we are focused on the particular signals which are interesting for us. That's why we are doing the metabolites, which are only in the small difference. So the difference between metabolites are maybe sometimes 10%, sometimes 5%, but they are statistically important. And in general, we can get the profile of the disease, as you can see on the right part of the slide. This is sometimes the tiny difference between the signals which show us the profile of the disease, profile of the healing processes, but there are, just to remember, very tiny, very small difference in the particular signals. So very small difference in concentration. And build up the model, predictive diagnostic models. We can just find out the group for just the patient who wants to be recognized if he has or she has the disease or not, and can be set in the one of those group. And we were doing all things manually just to have the macro in MATLAB and other languages. And one day comes to me Łukasz Prus from Ardigen company and asked me if we can do the program together, which make the automation from the beginning, from the making just the sample on NMR, and we can get at the end the result, the real result, which show us the results in the great number of the samples. So high throughput studies. When we need to, for example, to do 200, 300, 400 samples, and we are not able to elaborate them one by one. So we can do just by automation. And I said, yes, why not? And finally, he did the, by implementation of Nextflow program, he did the program which made completely automated NMR studies in metabolomics. He used the R program, Python, and Nextflow, and others that you can see languages which were used for this program. And this was done just step by step. So just to make the spectral layout fit, then the solvent suppression, apodization, zero filling, Fourier transformation, zero order phase correction, and so on. At the end, when we get the pathways analysis. And this was the topic of his PhD thesis. He spent on that 4 years. But finally, we got at the end the program, which is in the open source mode. So you can see here, this is Nextflow automatization and standardization from qualitative and quantitative analysis. And you can find out it at the home Łukasz download review NASC, because this program is NASC, call it NASC, from this name. And you can find it as the open source and use it if you would like to. So we were based on Bruker data, Bruker files, so we use them to elaborate. And all this operation was done one by one, so starting from load fit, then I said group delay correction, solvent suppression, apodization, zero filling, zero order phase correction, up to multivariate analysis, univariate analysis, and there is at the end one things more, it is pathway analysis. And finally, we can get the program which from compounds can find out the pathways at the end. So if we will run 100, 200 samples, 300 samples, we will know which group is control, which not. And at the end, we can get the results in the form of perturbed pathways. What is important to doing the samples, it is important not to do separately the control group and the subject, but should be done together, because then we can see some kind of the batch effect, which is not very good then to correct it. Not very easy to correct it. And this connection with KEGG, we can finally, as I said before, to get the pathway analysis. And this program is ready. Łukasz has the public defendants. I guess it was at the spring this year, so it was April, I think, and or March, I don't remember. But finally, we have the NASC NMR automation program for metabolomic study, which can give you the biomarker and offer you the models, offer you the perturbed pathway analysis. This is the link. This is http NASC github.com RDGen and the name of our program, which can offer you the pipeline to elaborate the raw fit from the samples to the end with the pathway analysis. And now a little bit about our study, what metabolomics performed by the NMR can do. So this is the one of our paper, historically one of our paper, first of our paper. Then we had the children who suffer diabetes type 1. And we want to see if they have the glycated hemoglobin low and high. We want to see if we can compare them just based on the NMR spectra. And finally, this result was very nice because we could see that when we have the control children and children with high glycated hemoglobin, that they are different. We found the metabolites which differentiate them. And even if we compare the low, it's still distinguishable. You can still distinguish these two groups. And also you can distinguish the children with low and high level of the glycated hemoglobin. And we can find the markers and the difference between low and high glycated hemoglobin. So this was our first work which we done, and after this we did many others, and one of the latest is serum metabolite and meta-alliance profile for breast cancer on a cancer screening. You may see that even small changes in our organism, when the tumors start to develop, then you can see the big difference in the body, big difference in the sense of big difference in the spectra, that many metabolites are perturbed. And here we use more than 200 samples, and you may see that this, if you have the rock curve, that you can see that the area under curve is 94%, is 98%. It means that this is the high, you can, with the high percentage, recognize the disease. Between those two groups, these are the persons who are sick and these are persons who are healthy, the green one. And you can see that the rock training curve is 94, while rock test curve is 98. It means that this method could be very good for screening the person who are suspected to have problem with the breast cancer. And we found a bunch of metabolites which are different between those two groups. We explain each of them almost, the influence of the body, but I will not going to do this because this is quite big paper. But what is important, we just do also metabolomics, and we saw that the arsenium, which is highest in the person who suffer breast cancer, and zinc, which is lower, and it is very nice in agreement with the literature data. And of course, selen is highest, which means that selen is in the highest level is toxic, but in the lowest level is also bad. So you must equalize this level to be in the range of people who are healthy. And one of the methods to help to treat the cancer is just the supplementation by the zinc. There are a few papers about that. So we did a lot of study with these samples because, as you may see, the number was 238, so quite good. We have the really unique access to the samples, and we could see that the prediction of the breast cancer is very good. But having such samples that we did also we use the AI, the machine learning methods, and they show us even better results than before. So this was the first time when we used the machine learning methods to NMR data and for metabolomics study. And we are very proud of that because next papers will be also done by this method. Next things is just gender-specific metabolomics approach to kidney cancer. So there is the proof that men suffer the kidney cancer more often than the women. And we want to see if we are able just by NMR to see why it happens, and if we can distinguish between the healthy control and the patient, and if we can distinguish between the woman and man profile of the metabolites. And finally, it happened that we can distinguish all these cases. So we elaborate the model for the men, for the women, and also for all the patient, that we can distinguish between the healthy control and each of that group. There you can see on the picture the difference which are from the sex, that is choline, histidine, acetoacetate, acetone, which are the same, which are particularly different for the man, and for the woman is pyruvate and glycine. And there's also a few others in the smaller case, and in the each case, sorry. And then you can use the really metabolomics done by NMR to distinguish the disease like a cancer. I will talk about lung cancer then, and about one case, but this is very important that NMR is very good, robust method just to make the diagnosis, make the screening, make the monitoring of the disease, like the cancer, like the inflammation disease also. Next things is when we use the NMR. At the beginning, we were doing the study with Italians from Siena group. When, if you transplant the kidney, you have the profile of changes. So you go from the first, second, and third area here, and you can see if the kidney will be accepted by the patient or not. And we were wondering if we do more, if we use more patient, that we can repeat it. And we saw the different stages, which you can see here on a picture, that you can go from one to the other. And if you not follow these changes, that it means that the kidney will be not accepted. So is that method, NMR is that method which allows you to say, okay, the kidney will be not accepted, the patient need the medical intervention that time, just from the serum. The first paper was done from urine, and all of biofluid which we use, so serum and urine, are diagnostic for that cases. And the serum is even better because you can take it in each time and just you can compare with the previous model, and you can see if the patient will accept the kidney or not. This is very nice paper which we did a few years ago. This is the brain dead and coma patient. If you have the people who are doing transplantation, organ transplantation, they have always a problem if the person is dead or not. And important is in the brain dead is. And we ask ourselves if we can recognize by metabolomics done by NMR the brain dead and coma patient, because some patients are in coma and they should be wake up after sometimes. And we use that model, and we saw that even the change of the brain dead we can see in the serum. It is really nice. However, this paper should be maybe controversial. There is the few papers about this subject. One of is our, and which show us that by NMR we can easily can demonstrate that this two group of the patient could be separated. So we can just say, okay, this patient is dead, this is just in coma, according to this data. And one of the methods which we use for the from metabolomics is also lung cancer. Lung cancer was our object many years of study, and we use the blood serum. Patient with lung cancer, we assign all the signals which were resolvable by us. You can see that 45 metabolites were found in the patient serum. Also in the healthy control, the same signals you can find out, because the difference are not in the number of signals that you can compare, but only in their quantity. Well, and we can build up the model, and it comes out that just to forecast or just prediction method is very high for that case. It means that very small tumor in the lung make great perturbation in our body, change the metabolites, even when we can see on NMR, and you can see that it's almost 99% of prediction. So it means that just looking at the serum spectra or plasma, probably also you are able to distinguish if someone is suffer cancer or not. It is important because still in each year there is about 25-30 persons suffering the cancer, the lung cancer. And you can see that you can even distinguish between early stage, so it's the first and the second stage of the lung cancer, and the advanced stage, so it's the third and the fourth lung cancer, and the prediction is very nice. Also, we found the metabolites which are changing between those of all of the investigated group, and you can see that difference are very, very small. So it's 3.7, 16.42, 7% is really small difference, but very repeatable in each sample when you consider the healthy subject and healthy object and our patients. And we are able even to distinguish between the early and advanced cancer. We have also the ability to check the person who suffered the cancer and who was treated with the drugs, anti-cancer drugs. And then we saw after the while that it comes to the group with the advanced lung cancer. So it was very, very bad prognosis. And we had also the studies with different lymphomas, and we have the 3 lymphomas, which was acute lymphoblastic leukemia, is AML, CLL is chronic lymphoblastic lymphocytic leukemia, and non-Hodgkin lymphoma, NHL, where the AML is the most the disease which is very aggressive. CLL is just the chronic, and then you can see that in this model in AML there is the big difference because there is the great perturbation in the metabolite profile, while in the CLL you cannot distinguish almost these two groups. And we did the models, and the models has the probability of the recognition of each of the diseases for HML. So the most aggressive lymphomas is about 97%, while for CLL is very low, is almost not distinguishable, so it's 58%. and two others are between them. So the NMR is showing you that you can recognize many diseases. You can see how the progress of the disease is, how aggressive the disease is. But also you can use NMR for the cancer cells. You can use the NMR, which we are doing actually. You can use for fungi just to check if they are drug sensitive and drug resistant. You can use them also for bacteria that we were working with Pseudomonas aeruginosa. And we just find out why Pseudomonas aeruginosa have a different behavior in the environment and different in the lungs, how they change their metabolism. They are use the different substrate in the environment, different in the lungs of the children. So NMR is really great method to compare the objects. We don't. I think I don't want to say that we don't care what the object is, that we can find the difference. But it is true that if you have the reference group and the group of the study, you can always find out the difference between them if they are present, just in the small changes in those two groups. And finally, I ask AI just to show us what is the metabolomics, what is associated with AI, and AI draw me two pictures. One is GCMS and one is NMR. It's big different. It's big different that we can use in the lab, but still there's some imagination of AI. Thank you for your kind attention.
Thank you very much. And I hope you have some time for discussion because you told me earlier that
Yes.
we are running out of time. Okay, so we are open for discussion. Anyone who wants to ask question, please turn on your microphone and camera. If your microphone is not working, please write it on chat. Okay, so maybe a starter question from me. I'm just curious about this brain dead case. Like, what's the maximum false positive result in the method to be used there as a method to really determine if someone is brain dead?
False positive, you mean that is, we have to look at the particularity to the papers, but we did the test group and training set also. So just I give you the answer after this
Sure.
after this seminar, okay? Example.
Okay. Yeah.
But was the great difference between the people who suffer coma and this with have the brain damage? Because mostly there are the people after the crash accident. Mostly are the people after some accident which almost killed them. And the doctor have the method to assess the person if it's dead or not just based on some symptoms. But what is interesting, there are the difference even in the molecular level. We also did such study for the calf which were in the cow and Verdi. So there was the great difference also in the amniotic fluids and the blood serum of the cow when the calf was dead. So there is really difference in the biofluids if something is going on in the body.
Okay. So anyone else wants to ask some questions? Give it a moment.
Yeah, hello?
Yes, Tomek, please.
Yeah, so would it be possible to implement parahydrogen-induced polarization, for example, for the detection of pyruvates? And would it be helpful?
I was thinking about that. First of all, it's very expensive. That we know that. But the pyruvate is used very quickly. So if they are present in that moment, what you can just freeze, let's say that you are able, but pyruvate, we can see the pyruvate also in NMR in the usual method, but depend what we are investigate, or the serum, or the cancer cells, or bacteria, or other subject. Because normally you can see the pyruvate. I don't know if we can.
Yes. Okay.
Yeah, even I was showing you, maybe I can just show you again. Just zoom, okay, that's like this. And then that you can see on the, can you see it?
We see that black
okay,
screen for
yeah.
a moment. Okay, now we can see it, yes.
We can see the pyruvate in the bunch of metabolite in different studies. Okay?
Yeah, okay.
Okay, anyone else? I don't think so. So thank you very much for your presentation. I show the next slide information. So in 1 week, we meet with Krzysztof Baj from University of Liverpool, who had his defense like I think a month ago, and he will give a talk, fast PK measurement for drug design using chemical shift imaging and chemical gradients. So thank you very much everyone for joining us, and see you in 1 week.
Thank you.
Thank you.
Sorry for
Bye.
all inconvenience, but it was technical problem.
It happens.
Thank you. Bye.